Good afternoon, and thank you for joining the Health Department's weekly Friday briefing with Dr. Farley. Today, we will be joined by Reverend Luis Cortez Jr., who's founder, president, and CEO of Esperanza Incorporated. Both he and Dr. Farley will be talking about COVID-19 vaccine distribution and ways that the city is making it available. Following their prepared remarks, we will provide Dr. Farley's remarks in Spanish. Then we'll open the floor to questions from the press. Today, as a reminder, we will be ending at 3:30. So now let's get started. Dr. Farley, you have the floor.
Thank you very much, Jim. So here's where we are with vaccination. First, the supply of the doses that we are receiving in the city is increasing. This week, we have allocated for receiving next week 22,000 first doses of the Pfizer vaccine. That's an increase of about 2,300 doses from the week before. And then 15,600 doses, first doses, I should say, of the Moderna vaccine. That's the same as it was the week before. In addition to that, there are about 6,000 doses, first doses now, going to pharmacy chains directly from the federal government. So we put all of that together, and there's about 44,000 total first doses arriving in the city. And in addition to that, there are all the doses that are being delivered at the convention center. That is a separate allocation from the federal government. That's about 42,000 a week, given the number of vaccinations we're giving per day. So the number of doses is definitely increasing, and that's a very good thing. How about as far as administration goes, as of Thursday evening, we reported vaccination of a total of 321,000 people for their first doses, and 131,000 people for their second doses. Of those people vaccinated with their first doses, 23% were African American, 5% were Hispanic, and 7% were Asian. Now, that's one way we're measuring our progress in vaccinating people in the city. Another way we're measuring progress is just the total number of doses, first and second combined, that are being delivered per week by all the providers in the city combined. And for the week ending February 28th, so that's a week and a half ago, there were a total of 54,000 doses that were administered. The number's higher than what I reported a few days ago because there was some late reporting. Then for the week ending on March 7th, so far we have 93,000 doses that are reported, a big jump up. Much of that increase is from the vaccinations taking place at the Center City Vaccination Center. But there are also increases in other groups of providers between the week ending the 28th and the week ending March 7th. A little bit on our people who are eligible for vaccination now. We're still in our phase 1B, which includes frontline essential workers, includes people with high-risk medical conditions, and it includes people who are over the age of 65. Now, before we had that limit being over age 75. As you probably know, we dropped that to age 65 the day before yesterday. And how is vaccine being made available? We are gradually increasing the number of provider sites, hospitals, clinics, and pharmacies. There are clinics that are being run by the Department of Public Health. Next week, on Monday, we're going to be our first time at Simon Gratz High School at 1798 West Hunting Park in Nicetown. On Wednesday, the 17th, we're going to be at the Grand Yesha Ballroom at 2308 Snyder. And on Friday, the 19th, we're going to be at the EOM Athletic Association at 144 Moore. Now, that same week, next week, we're also going to be doing second dose clinics at the Martin Luther King Older Adult Center in North Philadelphia, Community Academy Charter School in Juniata Park, and the University of the Sciences in West Philadelphia. And the following week, the week of March 23rd, the fire department will be running for the first time clinics at Cannstatter Volksfest Verein at 9130 Academy Road. And on the 26th, they're going to be at the Salvation Army at 5501 Market Street. And on the 28th, they're going to be at 7800 Ogons Avenue. That's a fire department facility that they'll be working out of. In addition to those community centers, and that's in addition to all the other providers in the city vaccinating, we do have now the Center City Vaccination Center at the Convention Center. This is a very high throughput operation. They are doing 6,000 vaccination per day or more. They become very, very efficient. People who are invited there are people from our vaccine interest form who are eligible. We are oversampling people in the less vaccinated zip codes. And most people are being invited by email. Some people are being invited by phone call. We're trying to gradually expand our phone calling capacity. We're involving now the 311 operators for making outgoing calls. We're looking to increase the phone calling further because many people may not respond to an email, but we're hoping if not, they'll respond to a phone call. Now, we know in the people who are being vaccinated at the convention center that we are having an underrepresentation of African Americans and Latinos. and underrepresentation of people in the lower vaccinated zip codes. So we did have a meeting on Tuesday night of this week with a large group of African American Latino community leaders to ask for their help and their advice as to how we boost vaccination amongst these populations that are the same populations that have the highest risk of serious COVID infections and mortality. Among the things they're doing is in an organized way, sending to us lists of eligible and interested people who can be directed as a group to the Convention Center for Vaccination, or they may actually have a church or community organization organize a group of eligible people and bring them on down to the Convention Center. And the city is working on providing free transportation for groups that may want to come together as a group and where transportation is important. What you're going to hear about in a minute from Reverend Luis Cortez is the work that we've been doing in Esperanza around trying to improve the number of Hispanics that come to these sites for vaccination. And we really appreciate his organization's really significant help. As you probably know, last night, President Biden made an important announcement. He said that he was going to be first providing more vaccine to federally qualified health centers and more vaccine to pharmacies. And then in a way which I think is even more important than that, he's expanding the number of people who can provide vaccination itself, the workforce, because the workforce is the greater limit right now. His announcement announced more federal staff being used for community vaccination centers, like the federal staff here at the Convention Center. And he's also expanding the list of people who would be authorized to deliver vaccine to be a wider group of allied health professionals and allied health professional students. Now, all I know about this is the press release so far. I haven't seen any of the details, but all that's really welcome news. And I think it should help. And the president announced, as you probably know, that he wanted every jurisdiction to have everyone eligible to receive their vaccine as of May 1st. And we will follow the president's lead on this. It's really great to see federal leadership on this, and we are going to be absolutely in sync with the federal government on this. Having the staff, additional staff to vaccinate people and run vaccination clinics is, again, that's our limiting factor. And this plan, at least the little we know of it now, right now, seems to be addressing that key issue. So what should people do who want to have vaccine? First, let me just say, people should not just come to the Convention Center expecting to walk in for vaccination. There are people trying to do that. We don't want people to do that. If people want to be vaccinated there or elsewhere, they should get their name in our database on www.phila.gov/vaccine-interest, or they can call 311 and someone will put their name in their database. And then we will contact people about the Convention Center or other vaccination opportunities. We now have some 328,000 people who have signed up, and that number continues to grow. But at the same time, the number of people who are in that database who have been vaccinated continues to grow. We know of at least 85,000 people who are in that database who now have been vaccinated. We match this against our vaccination database. And the match isn't perfect, so there's probably many more people that have been vaccinated that are not in that 85,000. So it's a pretty good fraction of the people who are in that database now have had that opportunity. So if anyone wants to have that opportunity, that's the best way to do it. And remind other people that if there's an organization that believes its workers are eligible as frontline essential workers or essential workers in the future, they can sign up at our organization website, www.phila.gov/business-vaccine. And we have started now to notify some of those organizations for the eligible workers and directed them to the Convention Center for Vaccination. So that's the update now, and we'll turn it over now to Reverend Cortez, and then I'll be available for questions.
Thank you, Dr. Farley, and thank you for the opportunity to be here today and to share. Esperanza has, my story, and it's good, a 3-minute story, is a mixture of great stories and then challenges. So I'll do the great stories first. We want to thank Dr. Staniford with Black Doctors. They did more testing and a significant amount of vaccines as an ad hoc organization, and they were able to work with us. We want to thank Cheryl Bettergold, who works for the Chronic Disease and Injury Prevention, City of Philadelphia. She has consistently been trying to get us vaccines to the Latino community, and so we're very appreciative of her work. Ketsi Lozada of Esperanza has helped close to 3,000 Latinos get vaccinated at 4 sites, the Leocora Center, Community Academy, and at the Convention Center. And one of the questions is, how have we done that? And we've done that by targeting our seniors, our restaurant workers, our home healthcare workers, and our education workers. We've also done outreach to senior citizen housing sites, churches, restaurants, bars, and clubs. I have not personally gone to the bars and clubs, but we have gone to the bars and clubs. And we literally have gone door to door in 19140 and 19122 and 24. We have presence at supermarkets and with home health care offices. It's not just Esperanza's doing this. We have North Square Civic Association, North 10, Aspira, St. Joan of Arc, and all the local Latino DJs who've been very helpful in working with us. We also want to thank Councilwoman Quiñones, who has been fighting to get us to get a site in the Hispanic community. And as of 2 days ago, Congressmen Boyle and Evans, who are calling FEMA on behalf of the Hispanic community, because we can't get FEMA to do a site in our area. And we feel that the statistics warrant that. We also want to thank State Representatives Burgos and Cruz. So that was the good news, right? We're working, and we're working together hand in hand with a lot of partners. What are the challenges? The challenge is racial equity. We talk about racial equity. Our city consistently says we are committed to racial equity, but we still haven't learned how to do racial equity. The Center for Disease Control Literature says in its website that the main strategy has to be where the people are. The Hispanic people live on and off of Fifth Street, from South Fifth Street all the way up to Fifth Street in Olney. So we need sites on Fifth Street, and we haven't been able to get them. It says to partner with local community organizations and leaders. And we've begun to do that, but we're behind. We're months behind. So I want to thank the commissioner because he has had calls with us now, and we have begun to do that. But it is a failure to continue to ask us to go to the convention center when it's clear that our people can't all get down there. When we can get them down there, we do. The failure to provide equity has become a major conversation, not just in our city, but in our country. The Billy Penn newsletter, the Inky have shown that the city has not been able to do the equity. If vaccines have been misdistributed equity-wise, we need to redistribute the new ones that are coming so that we don't have to wait. One of my concerns, and I want to thank the city, because in our conversation with FEMA, which has been it is now next Monday will be our 5th week of at least one meeting with FEMA. In our conversations with FEMA, they're talking about, well, maybe we can open a site in a month. If the intent is to have everyone by May 1st, we shouldn't be talking about opening a site in a month. So my perspective is we have to find a way to redistribute the new vaccine that comes in. And maybe some of the old vaccine, take it away from neighborhoods that are doing better and groups that are doing better, redistribute those so that we don't have to sacrifice Black and brown people and wait months for them to catch up. So it's good news and tough news. The good news is we're working at it and we've had some success. The tough news is that racial equity is really hard to do. And if it is hard to do, it means we have to take extraordinary measures to get to racial equity. Thank you.
Thank you very much, Reverend Cortez. Now turn it over to Ms. Delia Colon, who will present Dr. Farley's prepared remarks in Spanish. Ms. Delia, you should be able to unmute yourself.
Can you hear me now?
Yep, you're good. Thank you.
Great, thank you. Palabras del comisionado de salud, Dr. Thomas Farley, para el 12 de marzo del 2021. El número de casos está aumentando después de 2 semanas. Necesitamos tener cuidado. La epidemia aún no ha terminado. Quiero compartir algunas notas sobre el proceso de vacunación. El suministro de dosis va en aumento. Tenemos asignado para su entrega la próxima semana aproximadamente 86,000 primeras dosis en total. Hasta el jueves por la tarde, 321,000 personas han recibido su primera dosis. 131,000 personas han sido vacunadas completamente con las 2 dosis. A continuación, el desglose por raza. 23% han sido afroamericanos, 5% han sido hispanos y 7% asiáticos. En la semana que terminó el 28 de febrero, 54,000 dosis fueron administradas. Este número incluye primera y segunda dosis. Por su parte, en la semana que terminó el 7 de marzo, aproximadamente 93,000 dosis han sido administradas hasta el momento. Este incremento se debe debido a la operación del centro de vacunación en el centro de convenciones y a la inclusión de otros proveedores. Sobre la elegibilidad, todavía nos encontramos en la fase 1B, que abarca trabajadores esenciales de primera línea, personas con condiciones médicas de alto riesgo, personas mayores de 65 años. ¿Cómo la vacuna está disponible para el público? Bueno, a través de nuestras clínicas del Departamento de Salud, la próxima semana se estará vacunando el lunes en Simon Gratz High School, el miércoles en Grad Yesha Ballroom y el viernes en EOM Athletic Association. La semana siguiente, la vacunación se expandirá a 3 sitios adicionales. Se está vacunando también en el centro de convenciones del centro de la ciudad. Hemos alcanzado los objetivos en cuanto al número de vacunaciones por día. Aproximadamente 6,000 personas diarias se vacunan en el centro de convenciones. Las personas deben expresar su interés de ser vacunadas en la plataforma de la ciudad por internet o llamando al 311. Las personas han recibido la invitación para programar su cita por correo electrónico. Asimismo, está ampliada la capacidad del centro del contacto 311 para poder brindar mejor atención a las comunidades. Reconocemos que hay una representación insuficiente del número de vacunados pertenecientes en la comunidad hispana y afroamericana. El martes pasado hubo una reunión con un grupo grande de la comunidad latina y afroamericana. Se les pidió que recomendaran personas para recibir la vacuna. Ellos enviarán una lista de personas, organizaremos un grupo y proveeremos transporte gratuito para garantizar la vacunación de estos miembros más vulnerables de nuestras comunidades. Anoche, el presidente Biden realizó anuncios relacionados con la vacunación de adultos en los Estados Unidos. Esta vacuna será suministrada directamente a los centros de salud federalmente calificados y las farmacias. Tendremos más personal federal para asistir en los centros comunitarios de la vacunación. Este incremento aumenta la cantidad de personas autorizadas para administrar vacunas, incluidos estudiantes y profesionales de la salud aliados. Todos los adultos mayores de 18 años son elegibles para recibir la vacuna a partir del 1 de mayo. Esto es un recordatorio para aquellos que quieren la vacuna. Por favor, no se representen sin cita en el centro de convenciones. Les recordamos que deben registrar su interés en fila.gov/vaccine interest o llamando al 311. Ambas plataformas están disponibles en español. Las organizaciones pueden manifestar su interés en vacunar a su personal en fila.gov/businessvaccine. Ya se ha comenzado a notificar a los negocios que se han registrado y hemos dirigido a algunos el centro de vacunación del centro de la ciudad, ubicado en el centro de convenciones. Muchas gracias.
Thank you very much, Zelly. Next, we'll move to Q&A. Reporters are asked to limit their questions to 2 or fewer. Please try to keep your questions focused on the topic at hand today, which this week includes the work that Esperanza is doing. If there are any reporters who do not get the opportunity to ask questions before we end, please follow up by email and we will get you an answer. First up, we will go to Lauren Make from Channel 10. Lauren, you should be able to unmute.
Good afternoon, Dr. Farley. You said regarding President Biden's directive that everyone become eligible to receive the vaccine by May 1st, that you will follow the president's lead on that. How are you going to do that? What is the plan in Philadelphia to meet that goal?
Well, first, let me point out that being eligible doesn't necessarily mean that everyone's going to be vaccinated as of that date. It does mean that people will be eligible, but as we know right now, there are many people eligible in phase 1B that have not been able to get the vaccine yet. It would mean that we're moving into phase 2 earlier. We will, I think with the president's announcement and the follow-up on that, I'm hopeful that we'll be getting more vaccine and more federal support, and we'll be stepping up the number of doses that we deliver. And exactly how quickly we'll get through phase 1B and phase 1C will depend on how quickly we get that support and how much we can deliver. But I'm hopeful that we are well into phase 1C by that point, and that will make people eligible. Now, when they're eligible, it'll still be a wait for people because many will then suddenly become eligible. Be a wait for people to get vaccinated. But we hope to get through as many people as quickly as possible to get to that point.
You mentioned also the order that came from the White House today, making it possible for more people to administer the vaccine, people like dentists and veterinarians, for example. How are you going to go about using them in Philadelphia? Will people go to their offices, or will these professionals go to a vaccination site? How's that going to work?
Yeah, well, the announcement was just last night, and I haven't seen any of the details, but what it does is it creates a whole new pool of people who can be vaccinators. To give this vaccine, though, you need more than a vaccinator. You really need an organization of people who can schedule appointments and educate people and observe people after they've been vaccinated and record the data and send the data to the health department. But it does mean, I believe, that we can have more organizations out there who can be providing vaccinations. Those could be healthcare providers, or it could be new organizations that have formed where they have some of these allied health professionals working on them delivering the vaccines. So we're going to have to see what kind of organizations can come forward now that this has reduced some of the barriers. And the more organizations we have, the more individuals we have with that capability, the more we hope we can be delivering vaccine.
Thank you very much, Dr. Farley.
Thank you very much, Lauren. Next up, we have David Murrell from Philly Mag. Go ahead, David.
Hi, yeah, my first question is about the pharmacy expansion, which I know was another sort of part of the plan. I'm curious, like how much room there is to expand at pharmacies as it stands. Like, so, what percentage of pharmacies in the city are kind of currently available for administering vaccine? And if it's a matter of increasing the number of actual sites that are administering, or just like the throughput at the vaccines pharmacy sites that are in existence currently?
We think that there's a potential to greatly increase the number of sites. There are the chain pharmacies, which are not using all their sites for vaccination now, but they could. And then there's many independent pharmacies, and many of them that have interest in becoming vaccine providers, but are not enrolled yet, haven't gone through all the different steps in order to provide vaccine. So, I don't have a hard number on how many total pharmacy sites there are in the city, but it's certainly plenty. And we would like to have as many of them as possible enrolled and vaccinated.
And second question, do you think that you would be able to get through the 1B and 1C phases, or at least close to them, by May 1st, just with expanding access at pharmacies and by potentially expanding the provider, pool with sort of the dentist and other groups? Or do you anticipate that you would sort of need some degree of federal administration capacity, like, expanding the FEMA clinics to get there?
We estimated before that we would be in 1B until the end of April, and that we would be in 1C until the end of May. So the president's announcement would basically accelerate that by approximately 1 month. in order to do that, we will definitely have to step up the number of vaccines we administer each week. Now, the other thing is that if we're delivering more Johnson & Johnson vaccine, excuse me, it's easier to do because you only have to vaccinate each person one time. But in order for us to step that up, we will need to have more organizations and more people delivering vaccine. And so we'll get as much federal help in this as we can. The convention center has done a great job in vaccinating a lot of people in a hurry. And there's more federal staff in the president's plan. I hope that means more federal staff for Philadelphia. If it does, we will absolutely take advantage of that.
Thanks.
Thank you very much, David. Next up, we have Laura McChrystal from the Inquirer. Laura, go ahead. You should be able to unmute.
Hi, Dr. Farley, I'm wondering, you mentioned getting more federal staff. Are you hoping that the FEMA site, as a result of this, will stay open longer than 8 weeks, and that you would even get more FEMA sites to be able to speed things up?
We would love to have both, and FEMA and federal government knows that we would love to have the existing site stay longer, and that we would love to have additional sites. And we haven't heard any announcement on that, but that would certainly would be much what we would like.
Okay. President Biden also mentioned the hope of having, people vaccinated by July 4th to have more of a sense of normalcy by then. How many people do you think Philadelphia can have vaccinated by then?
I can't say that because by that point you're getting the uncertainty of how many people want to be vaccinated. But there are roughly 1.2 million adults in the city over the age of 18. Those are the people who are eligible to be vaccinated. And I'm guessing that 70%, maybe if we're lucky, 75% of those people will be vaccinated. So maybe that's 800,000 people. Now we're at well over 300,000 now. So we're not, we're close to halfway there. So I think that it's very possible that we could get up at 800,000 by July 4th. And that would be very exciting if we could do that.
Okay, and as things speed up and as eligibility expands, we still hear sometimes of seniors or people who have health conditions who are having trouble getting appointments. Maybe they're not as tech savvy, they don't have time to click around on websites. Are you worried about those people getting left behind as we rush ahead to open up to everyone?
Well, I think our distribution plan needs to have sort of two channels. There's just the high volume, places like the convention center that can vaccinate a lot of people in a hurry. Most of those will be people who are mobile, and so they may tend to be younger. And then there's a separate initiative to work for the people who maybe have less mobility or harder to reach or just more reluctant to come in. It's going to have to reach out to their neighborhoods or even their housing areas. And we're going to need to do both. There's going to be plenty of people who will never come to a convention center, but there's also plenty of people who can, and it's certainly much more efficient for those who can. And we at the health department are going to really be focusing a lot on the harder to reach while looking for assistance for the high volume operations that may be less hard to reach.
Thank you very much, Laura. I'm going to move on because we're running out of time. Pat Loeb from KYW, I'm going to bring you up next.
Hi. Dr. Farley, are new cases still on a plateau, or have they started to go down again?
I would say they're on a plateau for the past couple of weeks, and that's different from where we were before when they were falling.
So is that concerning to you?
That is concerning to me, yes.
Okay. And since you're having trouble matching your administration ability to the supply, about how many excess doses of vaccine would you say are in the city waiting to go into arms?
That number is actually a lot harder to come up with than you might think. We don't get good inventories from a lot of different places, but we know that each week when we allocate vaccine, it's difficult to have enough Moderna vaccine because that's in great demand, but there's plenty of Pfizer vaccine. So there's plenty of Pfizer doses stored around the city, but we're pretty short on Moderna.
Okay.
Thank you very much, Pat. Quickly, if we can move to Isabel Sanchez from Telemundo. Isabel, you should be able to unmute.
Thank you so much. Dr. Farley, regarding Reverendo Cortez' statement, I would like to know if there is a plan to increase the allocations of vaccines to organizations that work with Latino communities, including La Esperanza?
We are happy to allocate doses of vaccine to people who reach Hispanics, people who reach African Americans, any group that we feel is under vaccinated. Esperanza right now is not an enrolled provider. They cannot receive vaccine, but any organization that can reach the Hispanic population, we would be enthusiastic about giving them vaccine. We're looking now for more providers that can reach those populations.
So what can they do to make sure that they get selected? Is there a process? Do they have to apply through the city?
Yeah, any organization that would like to be an enrolled vaccination provider has to, first of all, have a licensed medical professional in that organization. And they have to complete a provider enrollment form, which is a CDC form that provides a lot of information. We verify their medical licensure and many other steps. And then they need to verify that they have the proper cold storage in order to store the vaccine. And they need to demonstrate that they can transmit electronic data on vaccinations to us. It's a pretty arduous process, but they need to go through those steps. But if they do go those steps, then they can get vaccine and they can bill health insurance plans for the cost of that. It's not a simple thing to do, but there are many organizations that can do it.
Thank you.
Thank you very much, Isabel. Ryan Briggs from WHYY, real quickly, and then we're going to close things up.
Thanks. I'll keep it quick here. Yeah, just to get a little more clarity on this, with the president's plan here, is the city developing new criteria for moving into the next phase? Is it changing any of the existing plans to move into the next phase? Is there, a certain benchmark for people in phase 1A or 1B that they want to cover before we, kind of move forward?
Yeah, so the president's plan, all we know about right now is the press release last night. We'd like to see more and have a real sense for how many doses we will get and how many people and organizations might be able to deliver vaccine. We have put out a plan before about 10 days ago for our vaccine distribution. We knew that would have a short shelf life. We're revising that plan now, and we'll have to continue to revise that. As we revise that, we'll see whether what our best revised estimate is for timeline of when we would move into 1C, but we will move into to phase 2 when the president wants us to.
Wonderful. Thank you very much, Ryan, and thank you to all of our speakers today and all of the assembled press. That concludes today's press conference. We will see you all again on Tuesday at 1 p.m. Thank you for your participation and for covering this important topic.